As we all know, the COVID-19 pandemic had a dramatic impact on all of us, but while a lot of attention goes to adults and older children, younger kids were also affected.
They absolutely are. Now, childcare professionals are sounding the alarm over a mental health crisis with a noticeable uptick in things like crying and aggression, and the impact extends beyond the kids. Now, joining us to help us understand more about this issue and what can be done are Dr. Angela Dawson, the co-owner of Cribs to College Academy in Detroit, and Allison Miller, a professor with the School of Public Health at the University of Michigan. Ladies, thank you for joining us.
Thanks for having us.
First and foremost, thank you so much for being here this afternoon. I want to start off with how are younger children, and more specifically their development, how was it impacted by the pandemic? And whichever one of you wants to speak on this first.
Okay, if I may,
Sure.
I want to clear something up first, if I may, as it relates to child development and mental health and pandemic. It's important for us to understand that what we're seeing in mental health was existing before the pandemic. However, the pandemic really just kind of turned the lights on a little bit more for us.
So it exaggerated those things.
Exactly, exactly. So I kind of want to get away from, this was a direct effect from the pandemic. We've had this deficit with mental health prior to the pandemic.
Sure. So we mentioned the aggression, sometimes crying could be some of those signs. Are there any other things that we can look out for?
Yeah, I would say thinking about especially young kids, we call it developmental regression. So things like they used to be potty trained and now they no longer are, can be sort of a sign of child stress. We know that really young kids show their stress and traumatic exposures in ways that can sometimes be not super clear to those of us who aren't thinking about it all the time. And so I think it's just a good thing to think about in general, what's happened with this child, how is this child doing? Because it can be hard to detect those early behaviors with certainty.
Right.
Yeah, we're talking about the kids right now, but reality is you have child care providers who arguably may not be equipped to handle this. What impact do you think it's having on workers?
So it's having I'll speak from the child care sector because I have the great benefit of being an owner of a child care center for about 27 years and working in the mental health capacity as well. And so as we are talking about staff, it has, to me, the greater impact on our staff because they are not equipped to be able to identify why the children are responding the way they are responding. And sometimes it's just a simple thing, well, the pandemic caused them to lack social skills. That does not necessarily mean that there's a developmental problem. But that moment of the pandemic, those 2 years, it took away 2 years of the ability to grow into being who they are as little people, being able to learn how to share and play with other kids, things of that nature. And so as a provider, I don't know why this child is having problems adjusting to other children. I don't know why they're crying excessively because they don't want to leave mommy and daddy. And they don't know how to differentiate if it's a developmental issue or it's just the recourse of not being able to socialize during the pandemic.
Sure.
And if I could just add on to that, absolutely, we were talking before. So I think the other thing is that all of those skills, these developmental skills, developed in the context with caregivers and caregiving relationships. So that's parents and caregiving providers. And so I think the other thing with staff and staff challenges and staff stress is that can pass on to children. And so you have stressed staff working with kids who are stressed, also not enough staff. And so that's a critical issue right now, this child care crisis that we're in, because it's taking more effort to do sort of one-on-one relationship building and emotion regulation, coaching, and all the wonderful things that child care providers do, but there are not enough of them, and they're generally more stressed, as are the kids.
So if someone is seeing these signs in their children and it's something that they're not addressing, not getting them the help that they need, what kind of impact could this have on the trajectory of their lives as they move forward?
Down the road?
For the children's lives? Okay, so it could have some long-standing after effects. However, what we're doing now is what we're working on now is trying to have staff properly trained to be able to, at least because you get the first 0 to 3 years, early intervention is a must, right? That's when it's grave. So what we're working on now is trying to get staff trained so that they can identify these things early. So when the children are ready to leave daycare and to go into the brick and mortar preschool level, that they are not having to carry these things with them, because what happens is your first 3 years are so important that if it's not met in those first 3 years, then it can become, you don't grow into a developmental issue, right? And you can't fix a brain. You can learn how to cope with whatever your deficits are. So if we catch them in the first 3 years, and when they're going to like preschool, which is about age 4 or 5, we have less stress with trying to reprogram what's wrong. So kids are resilient. We can teach them the proper skills, but understand that at this age, it's not really the children, it's the parent, it's the network that's behind the children. So it's most important to go into the homes or bring the parents into the centers, the counseling arena, and teach them the necessary skills to work with their children.
Go ahead.
We were just so excited speaking earlier, but I think the other thing connected to that is that absolutely it's so critical to support the parents and the providers, that whole social context where the child is developing, because absolutely it's something that is, you know, redirectable. Children are resilient, but also those first 3 years are so critical in terms of brain, organ, development, emotion regulation skills, learning how to cope, and so those patterns can get set up in a way that's not optimal unless we can help address it early on.
Perfect. So. And you two read my mind, because I wanted to end on an actionable item note of what can we do, and it's going into parents' homes. And you also mentioned, you know, the need to recruit and retain staff that have this skill set. So I want to give people some optimism, and this will be something to unite on together moving forward. Thank you so much again, Dr. Angela Dawson, co-owner of Cribs to College Academy, and Allison Miller, professor at the University of Michigan. Such an important topic, and you know, hopefully the study can help find solutions.
Thank you for having us.
We appreciate it.
Thanks so much for having us on.
Ladies, thank you. Pleasure's all ours.